Well, I want to thank you guys for coming tonight for this class. What we're going to talk about tonight is understanding pain, what causes it, some different treatment options for you, and hopefully at the end of the class you'll learn a little bit more about how your body functions and what causes pain and what you can do for it. So there's three basic reasons why your body would create pain. The first one is a response to an injury. If you have a whiplash or an auto accident, would be one reason. If you slipped and fell down the stairs, you would have pain as a result of that. The second is a response to or a warning that you're about to be injured. So let's say you had fallen down some steps and you hurt your lower back, and then you're walking along in the house and you go to take a step, and it gives you a warning that, oops, if we step here, we might re-injure this if we do something too heavy. You go to bend over to pick something up, and you notice, oop, there's pain here that's telling you don't do that or else you're going to re-injure it. So that would be a second reason. So it's a protective mechanism to prevent another injury. And then the third reason your body would create pain is an inability to adapt to a stressful environment. And where we see that mainly is with arthritis. Arthritis is a process of your body trying to protect itself and trying to keep it from injuring itself, and it lays down calcium to strengthen a joint, and that calcium will create bone spurs, and those bone spurs create pain. So that's a normal process that your body goes through, but it's an adaptive process that your body is trying to keep it from being injured, and so it creates this bone spurs. So response to an injury, inflammation or tight muscles when you injure it, warning sign that you're about to injure it, or 3, inability to adapt to it once it's been injured or if you place undue stress on it. Carpal tunnel would be a good example of an inability to adapt to a stressful environment. You do a repetitive activity over and over and over, your body sends a pain signal that says, you keep doing this, we're going to have problems. So in order for you to understand more about how your body creates that, I want to talk a little bit about your nervous system, and I've got a couple of tools here to help me do that. The first is the spine. And basically what happens, your spine is made up of 24 movable bones, and in between each of those is a nerve that branches out from between them. There's discs that keep the bones separated. And your brain sends messages down the spinal cord, out from between these bones and to your organs and your tissues in your body. When you touch a hot stove, that message goes up the arm, follows it up, goes through this nerve, into the spinal cord, up to your brain. Your brain says, that's a hot stove, you better pull your finger away. It sends a message back down, same pathway back out to tell you to pull your arm up. So that process of going up and coming back down is a reflex, and it does it through the nervous system. So when we have pain, it's following one of those, what they call a neural pathway. And neural pathways are when they travel up the spinal cord, they call those tracks. And you can think of a train track. So one track carries sensory fibers, one track carries motor fibers, and one track carries autonomic fibers. And depending on what signal we're trying to get to the brain or for the brain to get back to the tissues, it follows one of those tracks. When it gets off of the spinal cord and goes into the nerves, they follow specific nerves. So if it's a sensory tract, then it follows the sensory nerves. If it's a motor tract, it follows the motor nerves. If it's autonomic, it follows the autonomic nerves. So this poster is a really good example of explaining that. This yellow part is a nerve, and if you had an injury to that nerve, if it was, if the fibers that were underneath the part of that nerve was being affected was autonomic nerves, then you're going to affect the autonomic part of it. And the autonomic part is what controls your organs and your glands. If the part of the nerve that gets compressed or injured is the motor nerves, it's going to affect the muscles. And if the part of the nerve that gets injured is your sensory nerves, it's going to transmit pain. So when we look at this, we see that if this is the autonomic nerve that got pinched or affected, it's not going to create pain because autonomic nerves don't transmit pain signals. It's not going to affect the muscles if the autonomic nerve was affected, but it is going to affect the organs and how they function. If the motor nerve part was affected, it's not going to create any pain. It is going to affect the muscles. They're either going to be tight or weak, but the organs are going to have no effect on that part of the nerve being pinched. If the sensory nerves are what's being affected, it's going to cause pain or numbness. It's not going to do anything to the muscles, and it's not going to have any impact on the organs. So depending on which fibers are affected is going to determine whether you have problems. So when we have pain, it's because the sensory nerves are involved. So the sensory nerves, if they get pinched, they'll actually cause numbness because they're compressing it. So think of a garden hose, and you step on that garden hose and the water can't flow through it. If you're pinching a nerve, you can't get nerve flow out of it. So there's not enough nerve flow. So you actually get numbness as the sensory aspect. The sensory nerve being pinched will cause numbness. If it was a motor nerve, it would cause weakness. If it's an autonomic nerve, it's going to cause that organ to not work like it's supposed to. Now, what do you think would cause it to cause pain? If compressing it or pinching it causes numbness, what would cause pain? If it's irritated, if something's rubbing against it, or if there's inflammation around it and it sends too much nerve signal. In medical and science, they call that facilitation. It's sending too much of a nerve signal. So when you have pain, it's because of inflammation or irritation to a nerve fiber, not a pinching, which is a misconception in a lot of people's minds. A pinching will actually cause a numbness. An irritation to a nerve will cause pain if it's a sensory nerve. So what would cause irritation to it is usually inflammation. So when we look at treatment for pain from a medical standpoint, or an even over-the-counter standpoint, the most common treatment for pain, what would you say? Aspirin, ibuprofen, yeah, over-the-counter pain relievers. They call those non-steroidal anti-inflammatory drugs, or NSAIDs is the term for them. Non-steroidal anti-inflammatory drugs are pain relievers. So if we look at that, we realize that non-steroidal, so they're not steroids, anti-inflammatory drugs. So what they're trying to do is reduce inflammation. So they're acknowledging that inflammation is the cause for most of that pain. Now, your muscles can get inflamed, the joints can get inflamed, the nerves can get inflamed, and the ligaments and tendons can get inflamed. And anytime we see one of those things affected, it'll end with itis. So if it's a tendon that's affected, that's inflamed, it's a tendonitis. If it's a joint, it's arthritis. If it is a nerve, it's neuritis. And if it's muscle, it's called myofasciitis or myositis. And so when we look at that, we realize that there's 4 different tissues that can cause those swelling, or that can be swelling that can cause pain. Muscles, nerves, bones, and ligaments or tendons, soft tissues. So we've got over-the-counter prescription things, aspirin, ibuprofen, Motrin, Nuprin, those kinds of things, non-steroidal anti-inflammatory drugs. And when you put those into the body, it reduces swelling. It doesn't matter which of the tissues it is, it reduces swelling. Now, if those don't work, then you have to go a little bit stronger. When we go stronger, we get into the steroid, so cortisone, prednisone, those kinds of things. And typically you can take those by mouth. You can also take prescription strength non-steroidal anti-inflammatory drugs, and they're basically the same drug that you buy over the counter, just 3 or 4 times as strong. So they give you a prescription for them. And you can get into things like narcotics and opiates and things like that that trick your mind into thinking you don't have pain and to relieve it. If the things you're taking by mouth, whether they're prescription or non-prescription, if they don't reduce that inflammation and that swelling, then the doctors will typically go and try to inject it into the specific area. So you have pain in your elbow and you want to get rid of it, and you take something by mouth and it reduces pain everywhere in your body, but your elbow still hurts, they can go and inject it directly into the elbow so that it's more effective. The treatment is more effective because it's injected right into the specific area that needs it. So when they do injections, they can do steroids, they can do intramuscular trigger point injections, they can do muscle relaxers injected to a specific muscle to get it to relax, epidurals into the spine. They can even hook you up to an IV and do like a morphine drip that just is constantly putting pain into the blood, or pain relievers into the bloodstream to relieve it. If those don't do it, the next step is typically in surgery. And we can't fix with chemicals, so the next thing is structure. We go after the structure. So they'll go in and remove the bone spurs, or they'll shorten the muscle or lengthen the muscle. They'll go in and surgically try to fix so that the muscle's not pulling off of the bone and creating that tendonitis. They'll lengthen it, or they'll cut it so that it's not pulling. Anything they can do surgically to try to keep that swelling down around the joint or the area that's affected. And then the last thing, if that fails, is the last resort, is to completely kill that sensory nerve. And what they do for that is a procedure called radiofrequency ablation. And it's basically where they stick a needle into the area to irritate the nerve to find out which one, and when they hit the one that's affected, you scream and they know they got the right one. And then they send a radiation. They'll send a little bit of like an x-ray, a little bit of radiation into it, and that radiation kills that nerve, that sensory nerve ending. Now the thing is with that, all it does is transmit pain signals. So your body still functions. You can still have full range of motion because it's not affecting the motor nerves. And your organs can still work because it's not affecting the organs. And so they can kill those sensory nerves and your body can still function, but yet you're out of pain. So that's like the last resort, would be to do something like that. Now, there's safer alternatives, and so that's what most people are here for the classes, to find out what are some of those other alternatives. So the first one is, not surprising, exercise. Now, you think if you're in pain, the last thing you want to do is exercise. You don't feel like exercising, you might not be able to exercise. But exercising, even if it's a small amount of exercising, even if it's to a part of the body that's not hurting, if your lower back is hurting and you go do shoulder exercises, it's beneficial. If your neck is hurting and you go walk, it's beneficial. And the reason for that is physical stress or strain on the body causes your body to release its own pain-relieving chemicals called endorphins. So when you go and you exercise, your body releases endorphins, and these endorphins will actually block the pain. They'll keep the pain at bay. The strongest known pain reliever to man is morphine. Man-made pain reliever is morphine. Endorphins are supposed to be 10 to 100 times stronger. Your body can't make it. I mean, they can't make it in a lab. Endorphins are man-made. Your body makes this. The closest they can come to making an endorphin in the laboratory is morphine. That's how morphine was discovered. They were trying to reproduce or make endorphins in the laboratory. And the closest thing they came to was morphine. And it's 1/10 to 100th the strength of what your body can produce on its own. So exercise, physical activity, is a pain reliever. The second is nutrition. Your body wants to heal. Usually when you're in pain, it's because your body is not functioning properly, and so it wants to heal. So if it tries to heal, you can't stop it from healing. If you get a cut or a scrape or a bruise, it'll heal. And so it wants to try to heal. And if it's given the proper nutrition, then a lot of times it'll heal on its own. So making sure you're taking a multivitamin, making sure you're eating right, drinking plenty of water, the nutritional aspect definitely plays a part in your body's healing and in reducing that pain. Rest. Now, the Agency for Healthcare Policy and Research is a federal government agency, and they come up with healthcare policies. And they base it off of research. And their recommendation is, if you have pain, you do not want to rest that part of the body for more than 3 days. So if it's not better with 3 days rest, then you need to address it some other means. But rest is one of the recommendations for helping your body to heal and helping it to get better. You just don't want to stay in a restful state for any length of time. Is not good for the body. And then chiropractic care. I couldn't end the class without talking about chiropractic care and how it helps with pain. The first thing is bones, the joints. If that's going to cause arthritis. So if the joint is inflamed, it's going to cause arthritis or the pain from the joint being swollen. So it affects the bones and the joints. And we use adjustments and traction, things that get the movement back into that joint so it's working properly. For the muscles, we use electrical therapy, hot packs, cold packs, whatever we're trying to do to help those muscles to work like they're supposed to so that they're not causing a lot of the pain. Ice packs, we use a lot of ice packs around here to keep the swelling down. Again, anti-inflammatories are the main thing for pain relief, so ice packs are one of the best things for keeping that pain at bay. You cannot overdo using an ice pack. You can use it over and over and over and over, and you will not have any adverse effects of that. Heat, on the other hand, you can use too much heat, and heat causes inflammation. If you think about a sprained ankle, swollen, you don't put heat on it, you put ice on it. So anytime there's pain or tenderness or swelling around a joint or a part of the body, ice is going to be beneficial. The nerves. There's a couple of different things we can do for the nerves to reduce the swelling around the nerves. The interferential, the electrical therapy is one of those. Ultrasound is another one if a doctor has therapeutic ultrasound. And then they can also use diathermy. Diathermy is short sound waves like ultrasound that can push the fluid away from that body part that's not working properly and get rid of the swelling around it. And so that works for the nerves. And then the soft tissues like the discs, the ligaments, the tendons, those things, again, ice, electrical, muscle stem, interferential, can reduce the swelling around those soft tissues so that they're not inflamed. So you combine those things with physical activity, diet, nutrition, and water to keep everything hydrated, and rest and time, and most people can get over the problem. If you're not getting over the problem, it usually means you're missing something. You're missing some part of that puzzle is not there. You're either not getting enough rest, not getting enough water, your nutritional level is not there, the nerve flow to it is not proper, or some combination of those different things.